Gentlemen and ladies, greetings. We continue with Autacoid pharmacology, and here we are discussing serotonin, also chemically referred to as 5-hydroxytryptamine or 5-HT in short, because it is derived from tryptophan, an amino acid. So it is derived as a monoamine from tryptophan, which is converted first by hydroxylation, then decarboxylation through the enzyme activity of hydroxylase and decarboxylase respectively. Serotonin is concentrated mostly in the GIT, where it produces several actions including increasing motility, platelets, where it will influence platelet aggregation and eventual blood clotting, and the CNS, where it is involved in a number of activities, physiological activities including neurotransmission and related mood, behavior, and sexual activity. Serotonin, in terms of metabolism, and this is very, very important, is metabolized by monoamine oxidase, which converts it into 5-hydroxyindoacetic acid. Therefore, this metabolite, very soluble in water, it will be filtered through the glomerulus and appears in urine. So the amount that appears in urine can be an indicative factor of or parameter of the state of urine, the state of serotonin levels in the body. This is crucial in conditions where there are tumors that are producing excess amounts of serotonin, and they will be indicated by high levels of serotonin and eventual increase in the levels of 5-hydroxyindoacetic acid. What will be the pharmacological actions of serotonin? First of all, we have to agree that most of these chemicals, endogenous chemicals, will produce their effects by binding to and influencing receptors. So we have serotonin type 1, 2, 3, all the way to 4, which are highly characterized, and we are able to discuss their effects. So serotonin type 1 is found in the central nervous system tissues, where they will cause behavioral changes, including vasoconstriction. The vasoconstriction in this case related to 5-HT1 is very, very important, especially in conditions like migraine headaches or migraine syndrome, where the analog, the agonist of serotonin type 1 receptors, sumatriptan, and the related triptans are important in the abortive action or abortive objective of migraine attacks. Buspirone also to influence anxiety or relieve anxiety in those that have anxiety. So 5-hydroxytryptamine type 1 receptors agonists are very important in anxiety management and in acute management of migraines. Serotonin type 2, these receptors are expressed also by the CNS, where they regulate mood, they regulate sleep, they regulate appetite. For the smooth muscles of the intestines and the uterus and the bronchi, they will cause constriction because of contraction of those smooth muscles. For platelets, they will stimulate aggregation and facilitate clotting. For blood vessels, initially they cause constriction, but because of the large blood vessels effusing skeletal muscles, which are dilated by serotonin, we have hypotension as the final effect of serotonin. So in this case, we are looking at antagonists of serotonin type 2 receptors to reverse the effects of serotonin. For migraines, to prevent attacks of migraine, we have methotrexate. We also have ketanserin. Ketanserin also being an alpha blocker, it is very, very potent as antihypertensive. Then we have 5-hydroxytryptamine type 3 receptors, which are present in peripheral tissues, where they modulate reflexes or autonomic reflexes, and we'll be able to see when the when there is stimulation of the sensory nerve endings, there is release of serotonin that leads to not only pain, but also modulation of autonomic reflexes, which can lead to reflexes like the von Bezos-Jarisch reflex, which is hypotension and reflex bradycardia, but also autonomic reflexes like vomiting that is induced by cytotoxic drugs. Therefore, the serotonin antagonists at type 3 receptors are very, very useful in preventing or correcting reflux diseases where there is reflux of gastric contents into the esophagus. Also for vomiting that is induced by cytotoxic drugs. So we have examples of these drugs on the centron. We also have metoclopramide. We also have cisapride and the related compounds. Serotonin syndrome is a condition where we have excessive effects of serotonin and could be as a result of the inhibition of metabolism or inhibition of uptake or a combination of drugs that are working to increase serotonin effects. So this has to be watched for because we can end up with a fatal situation, and the signs will be increased rigidity of muscles, hyperthermia, myoclonus, mental changes, as well as tachycardia. Migraine. So let's look at migraine and how the main characteristics of migraine and migraine attacks and which drugs we can use. What's the approach in managing a migraine attack? So migraine is a common condition that is manifested by visual disturbances, where you begin to see stars, lights, poorly processed images, and it's as a result of the initial vasoconstriction that is observed as a result of neurological disturbances. So the vasoconstriction reduces blood supply to the image processing centers like the occipital lobe, and this leads to oral manifestations. But serotonin eventually, after the vasoconstriction, will lead to release of inflammatory mediators like bradykinin and prostaglandins. The kinins will cause vasoconstriction and vasodilatation, leading to excessive headaches as well as this congestion of cerebral circulation. So in other words, we are saying that there are two phases of a migraine. When it is starting, it's vasoconstriction, but the mainstay is vasodilatation. Therefore, if we want to manage this in the acute attack, we want to oppose the vasodilatation by giving vasoconstrictors. If we want to prevent the attack, we want to prevent vasoconstriction from taking place, so we give vasodilators and such drugs. So drugs used in acute attacks, like I've mentioned, ergotamine, we've talked about the serotonin receptors. Sumatriptan, we've talked about serotonin receptors, and the drugs that work against generation of prostaglandins and kinins, like non-steroidal anti-inflammatory drugs such as aspirin, ibuprofen, diclofenac, and the rest. Prevention, as we said, we want to counteract vasoconstriction effect in the early stages of a migraine attack, so we have mesigaide and cyproheptadine. Remember also that cyproheptadine is a classical first generation and H1 receptor antagonist, which is antihistamine, like chlorpheniramine, promethazine, and those. Cyproheptadine is very, very important in prevention of migraine attacks. But we are going to see also that cyproheptadine is anti-serotogenic, also can actually induce appetite by suppressing the effects of serotonin on the appetite centers in the hypothalamus. Calcium antagonists like flunarizine, calcium dependent release is or excitosis is inhibited. Clonidine, which is alpha-2 agonist, propranolol, also they inhibit serotonin release. Carcinoid tumors will be tumors that will be related to serotonin release, excessive ones as a result of tumors of enterochromaffin cells, mostly in the intestine. So there is excess serotonin, and this can be confirmed by high levels of 5-hydroxyindoacetic acid, which is secreted, which is released as a metabolite from serotonin metabolism. So the effects will be diarrhea, bronchospasms, flushing, and hypotension. Treatment is that we have to give antagonists, also anti-secretory products like Autacoids. Serotonin and appetite. Finally, we want to look at serotonin can suppress appetite. So if we give antagonist serotonin, we can actually manage those that may be having too much appetite and they have obesity. So phenethylamine and the D isomers can actually be useful because the isomers are actually more potent. What would be the problems related to these phenethylamine and related compounds? Headaches, insomnia, and pulmonary hypertension. Serotonin antagonists, just a summary, antagonists and agonists. We have buspirone, we've talked about serotonin type 1 receptor antagonists, dexphenethylamine suppressing appetite and used as anorexigenic. These are serotonin type 2 receptor antagonists. Then we have sumatriptan and the related triptans. These are serotonin type 1 receptor antagonists. We have cisapride. This one serotonin type 3 antagonist used in reflux esophagitis, as we talked about, but because of its induction in terms of activity of the conduction system of the heart, you have to find alternatives like tegaserol and metoclopramide to become much better. We also have cyproheptadine, which is antagonist, but it's also H1 receptor antagonist. We have ketanserin and ritanserin. Ondansetron, granisetron, these ones are serotonin type 3 receptor antagonists. The ergot alkaloids are also very important as antagonists, but some of them are actually agonists. So they are produced from fungus, which can infect grains. And so they will have effects on serotonin, they will have effects on dopamine, they will have effects on alpha receptors. Ergotism is a condition that is produced by excessive effects of these alkaloids produced from the same, leading to nausea, vomiting, abdominal pains, abortion for pregnant women, hallucinations, confusion, and convulsions of fitting. Examples of these ergot alkaloids which are useful in clinical settings are bromocriptine, which is indicated, for example, in hyperprolactinemia, where there is excessive production of milk. But this can be useful if the woman is breastfeeding. But if the woman has lost a baby, what is the milk for? So, and the breast will be engorged and painful. So bromocriptine becomes very, very useful in suppressing overproduction of milk. Then ergotamine useful in acute migraine, egonovine useful in postpartum hemorrhage, also lysergic acid diethylamide, not so very useful because of its hallucinogenic effects and addictiveness. Metsergide useful in prophylaxis of migraines, and dihydroergotoxin used in cerebral insufficiency. What would be the effects of these ergot alkaloids? Nausea, vomiting, abdominal pain, drowsiness, hallucinations, confusion, abortion, retrograde fibrosis, and gangrene, because some of them can cause constriction of blood circulation, and that will cause gangrene. And so we end here in terms of Autacoids, and this will be the focus even for your exam. May God bless you. Study well. All the best.